Good morning. My paper is on turbidity of cyst as a biomarker and association with systemic comorbidities in center involving diabetic macular edema. Diabetic macular edema is the most common cause of visual impairment in patients with diabetes mellitus, and it represents an accumulation of fluid within the central portion of the retina, which arises as a consequence of failure of blood-retinal barrier. These are the OCT patterns of diabetic macular edema. The first one is cystoid macular edema, second is spongiform edema, and third is the neurosensory detachment. Turbid cyst is defined as a cystoid spaces completely or partially filled with grayish, irregular, hyperreflective material without backshadowing in the OCT B-scan cross-sectional images. Our aim of the study, systemic correlations of center involving diabetic macular edema patients with turbid appearing cyst and with non-turbid cyst, and to evaluate the associated OCT characteristics in turbid appearing cysts like central foveal thickness, disorganization of inner retinal layers, and hyperreflective foci. Materials and methods, it was a cross-sectional study period from January 2022 to January 2023. 101 eyes of 70 patients with center involving diabetic macular edema is selected and is divided into two groups. Group 1 containing turbid cyst and group 2 with non-turbid cyst. We included patients who were diagnosed with center involving diabetic macular edema, and we excluded vitreomacular interface abnormalities, glaucoma, other retinal or optic nerve pathologies, previous history of treatment for diabetic macular edema. And baseline data collection include gender, type of diabetes, duration of diabetes, severity, other comorbidities, and ophthalmological examination like best-corrected visual acuity, fundus examination, and spectral domain OCT. And these are the OCT parameters. Central foveal thickness is a vertical distance from internal limiting membrane to outer border of the RP using the caliper tool in OCT Heidelberg. And hyperreflective foci is defined as the presence of small hyperreflective particles scattered throughout the retinal layers due to accumulation of proteinaceous material or activated microglial cells. And disorganization of inner retinal layers was defined as a horizontal band for which any boundaries between the inner nuclear layer, outer plexiform layer, inner plexiform layer cannot be identified. And coming to results, 51 eyes of 35 patients were included in group 1, that is turbid cyst group, and 50 eyes of 35 patients were included in group 2, that is non-turbid group. And the grades of diabetic retinopathy, moderate NPDR was a most common type of retinopathy noted. And comorbidity distribution of enrolled patients, hypertension was 57%. And distribution of hypertension in both the groups, it noted higher percentage in turbid cyst group than non-turbid cyst group. And chronic kidney disease also was higher in turbid cyst group. We noted dyslipidemia, almost the same percentage in both the groups. And HbA1c is also more in turbid cyst group with significant p-value. And central foveal thickness was also more in turbid cyst group. And other parameters like drill and hyperreflective foci were around 55% in both the, in group 1 with significant p-value. And coming to discussion, we observed individuals with turbid cyst had poorer glycemic control, longer duration of diabetes mellitus, presence of hypertension, chronic kidney disease as comorbidity compared to patients without turbid cyst, and poorer vision also. And we studied 51 eyes of 35 patients with turbid cyst, and we found association with hypertension, CKD, and no association with dyslipidemia. And OCT parameters were also more in turbid cyst group. And similar study conducted by Ramesh et al., they also noted these OCT parameters were more in turbid cyst group, and they found no association of systemic conditions like hypertension, renal, or cardiac disease. And study by Haute-Couture et al., they noted severe NPDR is the most common form, and we found moderate NPDR is the most common retinopathy noted. And study conducted by Aarti et al., they studied 131 eyes of 91 patients with DME and observed higher prevalence of hypertension and lower serum triglycerides in group with more hyperreflective foci. And take-home message, turbid cysts are commonly observed in patients who have concurrent conditions such as nephropathy and systemic hypertension, and they often indicate a poor visual prognosis for patients as they are frequently associated with presence of disorganization of inner retinal layers, which is an ischemic marker. And the presence of hyperreflective foci is an inflammatory marker, such as corticosteroids may be more effective treatment option than anti-VEGF, and this finding could potentially lead to modification in the treatment approach. These are my references. Thank you.
You said moderate NPDR, but you found a lot of CKD. Did you by any chance miss PDR? Because CKD is not so common in moderate NPDR as compared to PDR. The second thing, your conclusions are not, you said duration. I don't think you talked about duration of these patients of diabetes. How long was the diabetes? You didn't say, but you concluded that duration was a cause. Did you say?
In the slide it was not there.
Then how can you conclude, give a conclusion like that? The last conclusion, just put that conclusion slide. Yeah, again, inflammatory marker in a turbid cyst, that corticosteroid. Did you conclude that the inflammatory marker is more in that?
Because hyperreflective foci was more in the turbid cyst.
Inside the cyst?
Inside. Not inside the cyst. Overall, in turbid cyst group, hyperreflective foci was more.
No, but that is because the disease is more advanced in that. You are saying hypertension and everything is there in overall systemic. So sort of other factors are coming into this. It's not just the turbidity is not really may not be related to inflammation. Too many factors. So this may not be the way to go about it, like just doing percentages. Then you have to do some multivariate analysis for.
Nice study, but what madam is trying to say is that from what you presented, you might have to maybe analyze it differently to come to this conclusion. From what you have said, this conclusion may not be absolutely valid.
We haven't studied the treatment approach.
Correct. Exactly.